The topic that I chose to present on was Jean-Baptiste Leroy and how he used electroconvulsive therapy for mental illness in 1755. Some background information on Leroy includes that he was a French physicist who centered most of his research around electricity. He is also well known as one of the first scientists, specifically in 1749, to successfully construct an electrometer, which is a device that is able to detect electrical charges and voltages. More relevant to this class, Leroy is known as the first scientist to perform electroconvulsive therapy as treatment for mental illness. It was reported that in 1749, Leroy used electroconvulsive therapy, or ECT, on a patient with psychogenic blindness. According to Electricity in Medicine, which was published in 1755, Leroy was able to cure the case of hysterical or psychogenic blindness with 3 rounds of ECT. In Leroy's times, or in the beginning stages of ECT, the therapy would involve larger electric currents being given to patients without anesthesia. This would often lead to memory loss, bone fractures, and additional and more serious side effects. Electroconvulsive therapy today is done under general anesthesia, and it uses a small electric current which is sent through the brain, which then triggers a brief seizure. The procedure is supposed to create a change in the patient's brain chemistry and subsequently overturn symptoms of certain mental illnesses. Usually the treatment is utilized after other courses of action have been taken, and is more likely to be successful when the full course of treatment is concluded. However, it still may not work for all patients, and there are still risks involved. Some of the possible side effects include confusion, and the patient may experience confusion for a few minutes to a few hours after the therapy, and it's usually more commonly reported in older adults. Another side effect is memory loss, so some patients may have difficulty remembering things that took place right before the treatment was performed, or events that occurred during the weeks of the course of treatment. However, memory usually returns back to normal within a few months after the procedure. Nausea, headaches, jaw or muscle pain are also possible side effects, and the treatment is not recommended for patients with heart problem due to the increase in heart rate and blood pressure that occurs during the procedure. Electroconvulsive therapy is most commonly used to treat severe depression, treatment-resistant depression, severe mania, and finally agitation or aggression in people with dementia.